Us are one of our top experts, Clay Crossan. So Clay, the amazing thing is we're making amazing progress in terms of, as I like to use the Trumpism, I'm going to call it. It's huge. And what happens is that people try to think it's an alternative. No, I actually get insulted when I hear people talk about alternative medicine. No, this is integrative functional medicine, which means if you are a plastic surgeon or a dentist, or an orofacial surgeon, or if you're an internist or a pediatrician, you can benefit from using what we call integrative functional medicine, because it includes surgery, imaging, genetics. It includes herbology, intermediate metabolism, and genetics, epigenetics, plasma physics. It includes everything. Everything that can influence the biological state of you in the environment around you is included in functional medicine. And it's also based on science and testing. And because we have testing that includes blood, urine, stool, genetic tests, imaging studies, etc., we can validate what we're doing is amazing. So when we look at our nutraceuticals for Nutrimedical, they are very unique. This is not like this is not the 1990s, the 1980s, and 1970s. Unfortunately, whether they're herbologists, chiropractors, or even doctors take a weekend course in functional medicine, they're just starting in kindergarten, and there's a lot more to it. In fact, I mentor doctors all over the world, and I tell them I'm not going to charge them, but if they have a case, and that case is a consult, I will consult and charge for the consultation and train those doctors, whether in Santiago, Chile, or I have some doctors here and naturopaths in America, or doctors in Germany or South Africa or Malaysia. I'll train any of them. And the way I train them is case by case, which is the best way to train somebody. It's just like going through a residency, only this isn't like an online functional medicine residency. I'll tell them what labs, what clinics in different countries like Germany, Mexico, Europe, America, Canada, what types of labs are available to do testing, what kind of technologies like the QRMA, the Chinese version of the Russian Metatron called the Bioplasm, how to use these testing equipment. In fact, I had a doctor who wants to purchase one and wants to use it in her office, and she wants to know how I will consult her to teach her. I said, I'll teach you case by case. That's the best way to learn this. And that way, I'm flexible for her time. We can connect by phone or Skype. The neat thing about it is functional medicine is going to take things over. I don't care if you're a general surgeon, an internist, or whatever you are. We're going to help you to be a better doctor. I'd just like to throw out a few different... today, rather than focusing just on nutraceuticals, I like to talk about different specialties. Let's say you're a dentist and you decide you're going to get into biological dentistry. And you want to make, and I had a case this morning, a gentleman has what's called a cracked tooth with cavitations. It's called NECA, is a fancy term, around his tooth root, because what happens is membranous bone, when there's chronic inflammation or infection, doesn't get less dense. It retracts away from the tooth, and the sharp A fibers that hold the tooth root in place literally snap. You get a pocket of infection and dead tissue generated by nanobacteria and secondary bacteria that grow in there. And if you don't take care of it, the osteomyelitis will not only eat away at the bone, so you can't even put a titanium post in there, but they can spread to other parts of your body. For example, most people don't realize that the nanobacteria that cause BOF or brain on fire are in your teeth. So if you don't have good periodontal health, it will dramatically, 80% of the cause of Alzheimer's is triggered by the periodontal tissues and their health around your gums. Isn't that interesting? 80% of the cause. That's scary. In other words, if you've got periodontal disease, and the same thing I see in heart disease units. I remember when I worked in the heart transplant and coronary care unit, and I can tell you, in various hospitals around the country, every single case that had multiple bypasses, heart transplants, and everything had awful periodontal tissues. Every one. Not exceptions whatsoever. So here's what you do first off. Allicin Med to knock off the nanobacteria. Also brush your teeth with Silver 100. You want to heal the tooth root. You want to be taking our bone generator. You want to heal the sharp A fibers and the actual 42% of the bones, but an even higher percentage of the enamel and the part of your tooth that it's crystallized on is collagen, special types of collagen. It's like rebar. So you want Collagen Max. You want to have Micelle D3 and Myco D2 and full vitamin K2. And you may also take the Pro Collagen Stimulator, Her Majesty's Royal Jelly. But the core is you need to take all the nutrient building blocks. And by the way, there are no competitors. When you look at our bone generator, it includes a number of growth factors. It includes the type 1 collagen in it. It includes the hydroxyapatite crystals, which is the only way to take calcium. For God's sake, do not just take, we call the White Cliffs of Dover calcium or some other form of calcium. You want to take calcium in its nascent form. So when a lion eats its prey, it eats the bones. That's the best way to take calcium, eating bones. So let's talk about these products.
CoQ10 Supreme. Would you use that also for the gums? Gums?
Actually, I would use the CoQ10 Supreme Ubiquinol. To heal the gums and the periodontal tissues, CoQ10 Ubiquinol, I tell people to puncture it with a soft gel with a corn skewer or a sharp knife. Corn skewer works really well. And then squeeze it and keep it in your gums 10 to 15 minutes and just swallow it. But you're right, the CoQ10 Supreme Ubiquinol. The Ubiquinol is the one that works in your brain, your gums, and your tissues. The CoQ10 is the BAM Supreme. Is the only non-crystallizing CoQ10 in the market anywhere, whether it's the doctors or others. And then if you want to heal the tissues, too, you need phospholipids, Nutrifos, Neurogen, and the minerals to go with that, which includes Vitamin Mineral Max and Minerals Plus, and our copper Regenamax, because a lot of the time you need a little more copper with a copper-zinc ratio than just the copper-zinc ratio in the vitamins. So, yes, you need to do all these things because most people are deficient in one or more things. Most of the process of aging is due to three things: nutrient deficiencies, metabolic genetic blockades or epigenetic blockade caused by toxins, right? And the third factor is chronic stealth pathogens and increased tissue inflammation. And if you deal with those things, the body will start to heal itself. You know, it's like the Field of Dreams. If you build it, they will come. You know, the Field of Dreams, to build a fancy baseball stadium. If you supply the body with its building blocks to jump over gene defects, you pull out the toxins, you help give this things. For example, we're not just giving calcium when we give bone generator. We're giving the type 1 collagen, growth factors, or adhesion molecules for your bone to regenerate. This is a much more complex formula than just say, well, this is my calcium. No, it's not. This is like light years ahead of that. So let's go over some of the components that help this poor gentleman that had this problem this morning. And I try to keep it to the simplest things, but if simple doesn't work in 3 to 4 weeks, and you do another pan X-ray scan, and your NECA is still there, and again, I recommend a biological dentist so they can do ozone therapy and YAG laser to cut out the dead tissue, because if you don't cut out the dead tissue, how's it going to heal? You've got to cut out the dead tissue. But you're not going to regenerate unless you take our supplements, and I recommend augmenting therapy like the NICO setting of Lumen Photon, and you can even use the micropulse Schumann resonance generator to regenerate bone. I've been using magnetic regeneration of bone for 30 years. We had a company out of Phoenix, Arizona supplying us, and I started doing research in the late 70s with the head of orthopedic surgery at the University of Calgary, and we were implanting magnetic field stimulators for bone. We had people flying in from Bahrain, Arab Emirates, London, all over the world for us to actually put these magnetic generators and put them right in their special casts that we'd actually make. They weren't, the normal old style casts. They're made of these new materials that we also were developing. So what people need to understand is we have a level of expertise that can prove that this works. And if you repeat your x-rays, if you repeat your bone density studies like DEXA bone scan in 6 months, or you do a deoxypyridinium and pyridinoline collagen subunits in your urine, which you can do through labtestingdirect.com at Genova Labs in Atlanta, it can show you in 3 weeks that you've reversed bone and tissue and enamel degeneration. Most people don't think, well, what is enamel? What is a tooth? It's constantly regenerating itself. And if you don't provide the nutrients, your teeth fall apart, literally, as you get older. Interesting, eh?
Oh, for sure, yeah. I really like that bone generator. It has everything that the body needs to rebuild bone. All the, of course, calcium and magnesium, but also has in there all the trace minerals and type 1, type 2 collagen growth factors. And what it's nice about it is it's not all packed together really hard. It's like it's in a sponge-like matrix so that it can be absorbed much more effectively and efficiently than just calcium alone. Because bone is just not made up of just calcium. You need all these other components.
Exactly. And of course, MyCell D3, if you don't have D3, and by the way, in our bone generator, we also have the growth factors that help the osteoblasts lay the new bone. Full vitamin K2 menaquinone 7 is essential for your osteoblasts. MyCell D3 and MyCo, which is a mushroom-based D2 with ergothioneine for regeneration. First receptor activated by your stem cells to regenerate is ergothioneine. Clay, next doctor I'm going to pick is a plastic surgeon, or somebody who does with plastic, an orthopedic surgeon. Let's say plastic and orthopedics. And the first thing I'd recommend is Collagen Max after surgery, and also to stop the post-operative inflammation, so you get proper knitting of tissues and you don't develop an eschar or scar that's abnormal. So the first two I'd pick would be Collagen Max and Inflamex. You can also add Her Majesty's Royal Jelly for pro-collagen, and topically to heal the skin to prevent other issues would be curcumin cream and pregnenolone. So let's talk about at least the first few, Collagen Max and Inflamex. These are important, and if you're an orthopedic surgeon, if your bones aren't strong enough and you put an appliance in, it's going to shatter or the screws are going to pop out. So you got to make sure you have dense bone that has collagen. So again, the Collagen Max makes up 42% of your dry weight of your bone. You can add to it Mountain Red Velvet. And you want to make sure that you have good bones, so you want Bone Generator, Micelle D3, Myco D2, full vitamin K2, etc., in order to do it, just like we mentioned for the dentist. But let's talk about Collagen Max and Inflamex for plastic surgeons. They do a lot better job if they had those two in their armamentarium, wouldn't they?
Oh, they sure would, that Inflamex, especially for post-surgery repair. The ingredients in Inflamex have been studied extensively for over 30 years, and what they've been shown to do is help healing with cuts and abrasions. There was a study done with professional boxers, and they found that the boxers that took the ingredients found in Inflamex, they healed 2 to 3 times faster than the boxers that didn't take anything or took placebo. And so very effective at helping, like a little Pac-Man going in there to eat up all the debris and inflammatory things. Maybe you can explain a little bit better how it works.
Yeah, well, there's two things that are happening. When you want to get enough inflammation, it marshals the resources of the cells to bring in stem cells and the growth factors and the subunits of collagen and so on. But inflammation is supposed to pass. And if there's debris left, it actually interferes with the cells to migrate and build a structure of the tissue. So a serrapeptase, which is a silkworm enzyme, actually helps to break down the debris, and then the digestive enzymes that are present in Inflamex, it's a Wobenzyme N formula, but 10 times stronger. It actually chews up that debris, so your cells, macrophages, can eat it, pull it away, and it doesn't block your lymphatics. If you block the lymphatics, the tissue gets edematous, and then it doesn't have the perfusion to actually heal because the oxygen concentration drops, nutrient ingress and oxygen ingress to the tissues drops, so the rate of healing decreases. So you want to make sure you've got good perfusion, which means you got to prevent edema, you got to get rid of the debris so it doesn't block your lymphatics, and you got to be able to have the whole process, turn on the alarm, but once the 5-alarm fire is on and the fire chief is there, they don't need to have the siren still going. So that gives you the basic idea. So if you use those two things alone, that would be a good start. Then we would add things like maybe Her Majesty's Royal Jelly, Mountain Red Velvet. If you're dealing with trying to prevent an orthopedic disaster, I tell the orthopedic surgeons, and I tell patients this a lot, do an MRI arthrogram with radiomagnetic dye, determine if there's debris in there, or just go in and scope it, even better, then you don't have any exposure to technetium-99, and clean up the debris, deburr it, and then put Hyland, which is 3 million molecular weight polymer, and then start taking our tendon bender joint performance and Collagen Max to rebuild the joint, rebuild the hydroviscous layer. I can't tell you, 90% of the people that tell me that their doctor said they need a joint replacement, they don't. They just need to clean up the debris and put a Hyland injection and then start taking things so their body makes their own hydroviscous layer, rebuilds the collagen around the connective tissues and the ligaments, and rebuilds and turns off the inflammation of the peri-articular materials like the tenosynovitis and the other inflammatory changes around the joint, and rebuilds the cartilage, the glycosaminoglycans. So tendon bender, joint performance, again, like we mentioned before about bones, Mountain Red Velvet, and Collagen Max. And when we do that, people say, I can't believe it. It's like I had a lube job. It's like, yeah, you didn't need. I had one gentleman last year. His doctor, oh, for sure, you need a joint replacement. And I said, what? And then the orthopedic surgeon says, oh, yeah, you need one. And I said, why don't you get the doctor to scope that knee? And, of course, the doctor decided to go ahead and do what I recommended, which is an MRI arthrogram of the joint. And he scoped it and said, oh, the only thing that was wrong was behind the patella. The knee joint was perfectly fine. no debris, no problems, no partial tear of the ACL, PCL structure. I'm thinking, you're kidding. They almost went in and did a knee replacement. All he had to do was realign the ligaments around his patella, which is a patella realignment, and to deburr it and get the garbage out from behind the kneecap and put in a hydroviscous layer so it wouldn't be grinding against cartilage. And then we start giving him the supplements, and he's a happy camper. He needed a minor procedure. His knee is working fine. He'll be good for decades. And I also warned him, don't take your knucklehead doctors, non-steroidal anti-inflammatories, or steroid injection to your joint. It'll destroy the collagen, destroy the glycosaminoglycan, and dry the damn knee joint out. It may temporarily stop your pain, but now you're not hurting while you're ripping it apart. So if your doctor gives you advice to take a non-steroidal or take a steroid shot, tell him to forget it. Clean out the joint, get the garbage out of there, and put a hydroviscous hyaline injection, and get out of there, and take our Inflamex, right?
Mm-hmm.
So let's talk about that. What about tendon mender and joint performance? These are really top notch sellers. People really love them because if they take them for a period of time, along with their Inflamex to reduce the joint inflammation, they don't have all the negative side effects of heart attacks, dry joints, gastric erosions, ulcers caused by non-steroidals, or the danger of stupid things like steroids. Mm-hmm. Right?
Yeah, well, the tendon mender you get in there vitamin C, but also you get in there the mucopolysaccharide, which is a type 1 collagen. And so you're taking these other drugs, they can limit the body's ability to even absorb these types of nutrients, which is what the body really needs to help repair itself.
Right.
So you're really doing yourself a disservice by taking some of these over-the-counter medications.
Yeah, exactly. Yeah. Now, it's not just a disservice, it's actually destroying the joints. Because I've been in practice long enough, I've actually seen the era of the rise of the H2 blockers, which we thought only doctors should use very carefully. When you take an H2 blocker, it actually blocks the histamine 2 receptor within 15 to 20 minutes. Now, if you take a proton pump inhibitor, it starts to work in a day, and it isn't fully operational for 1 to 2 weeks. So, when you take these drugs, these are, again, stupid drugs that disrupt your not only your stomach digestive enzymes. And this is the next thing. Let's say we're talking about a gastroenterologist, and we have kids and adults with dysbiosis. They don't even understand what dysbiosis is and how common it is to cause hiatal hernia, abnormal peristalsis, which causes gastric or bile acid reflux, for example, during pregnancy. One of the more common things we see is bile acid reflux problems, and gastroheal is one of the things we tell people, whether it's in their oropharynx, their duodenum or stomach, or even in the rectosigmoid. Gastroheal will coat their GI tract and stop a lot of the inflammation. Even to your lower rectum, you want to add probably the colon cleanse to clear out the lower bowel and to heal it. But gastroheal is amazing, isn't it?
Oh, for sure.
Thank you, Clay. We will see you again next Monday. You take care, and too much talking, not enough for my sparkly water. Back in a moment with Ryan, and I will have my voice. Ryan, one of our other experts here at the Nutrimedical team, one of the most amazing things is to turn it around and say, well, let's see if we were going to improve the functional practice of a doctor. And I think we did 3 different kinds of doctors with Clay in the first segments. We talked about dentists. We talked about plastic surgeons and orthopedic surgeons. Do you want to pick a doctor type, and then we'll try to pull some nutraceuticals that could help make him a better doctor? Let's put it that way.
Which doctors did you already do?
We did basically a dentist, plastic surgeon, and orthopedic surgeon.
Okay. Maybe a rheumatologist?
Yeah, let's talk about that. Okay, so what would you use for rheumatology? Probably something like our Inflamex and our Cell Defense and things to rebuild the joints, such as tendon mender, joint performance, and collagen max. Do you want to talk about some of these?
Well, when it comes to the better mobility and reducing the, like you were saying, the inflammation, I think that was a good choice right off the bat, the Inflamex, which is proteolytic enzymes. Those are designed to help get into the body, not just, say, digest food, which is different than what most people think about enzymes for. Right. And the Inflamex can be used in more chronic or even acute situations to help remedy the inflammatory process that's going on in the body. So that's a good one to start with. And then also adding in something like the Cell Defense, where you're talking about the really bioavailable form of curcumin to to also help support the body and the inflammatory process going on. And certainly love the shakes like Life Support, coming at it from so many dimensions of gut health, proper detoxification, but also an abundant amount of herbs that are designed to help support that inflammatory process going on in the body as well.
Yeah, exactly. Now, the other thing, of course, believe it or not, osteoarthritis, talking about leptin metabolic has a powerful effect there. Why does it work?
Well, leptin metabolic is a very unique molecule that basically is, was kind of found by accident in researching other types of glucosaminoGlycan fractions that could help support arthritic issues. But the interesting thing about leptin metabolic when it was starting to be studied was the fact that it had a major impact on the way that leptin is sensitized in the body. Leptin, very interestingly, is produced by our fat cells, and our brain should pick up on that messaging and let us know about the abundant amount of fuel that our body has, which can help us regulate our caloric intake, which a lot of people do need that support with. But at the same time, when they were studying it in humans that had issues like osteoarthritis, what they found was a reduction across the board in inflammatory markers that occurred not only in the synovial tissue, or I should say synovial capsules, but also across the spectrum on their bloodstream. And so it's a fascinating thing that it's probably a chicken and the egg issue where you're seeing insulin reduction due to the leptin sensitivity that then changes the inflammatory process going on in the body, which, as we know, many joint dysfunction type issues are really just a metabolic process that continues to occur in the body that's destroying it.
Yeah, another thing that we found out by chance, and this is with initially the products Alamax Alamed, but even more so with Allicin that is 200 milligrams more stabilized allicin from our German source, is that when you take and get rid of stealth pathogens in the body, you reduce joint inflammation, and it also help the tissues heal. So Allicin Med will help. We also found that topically the use of pregnenolone, which is a natural anti-inflammatory, by the way, in the 40s and 50s and 60s, before non-steroidal anti-inflammatory drugs, pregnenolone, both creams and tablets, and of course the creams were not liposomal. This is a liposomal cream, so it's more absorbed. And curcumin, which is an adaptogen, in its liposomal form, it's very, very powerful because ordinarily curcumin is the most powerful and most important nutraceutical on the planet, but it is very low bioavailability unless it's put in a special form with our cell defense tablets that have bioperin to make it absorb, or liposomal curcumin. But these two creams also help with pain tremendously. So if you have inflamed joints, pregnenolone and curcumin cream are really helpful to heal the joints.
Yeah, and using a different delivery system can be very helpful for a lot of individuals if they haven't used that as well. So being able to apply it to the skin can be an advantage as well.
Now, pick the next doctor. What's your next doc? I try to change it up a bit, so each time we're picking different doctors. What about an obstetrician? What would you say would be the first things that you want to recommend that the obstetrician, say, tells pregnant ladies?
Well, for a lot of people, when it comes to women's health and pregnancy, obviously, it's just making sure you're just doing the basics, like essential fatty acids and good supportive macronutrients.
Yeah, let's start off with, I'd recommend they take both, they basically take Vitamin Mineral Max Minerals Plus. They need additional folic acid. I would take superfolate and Power-methyl B12 tablets and Bio-LVR. And I would make sure they're taking extra calcium magnesium in the form of the actual bone crystals, type 1 collagen, and growth factors, which is bone generator, micelle D3, and of course our iron is the ferritin, which is iron 3 made from beef spleen. Let's talk about these for a minute. Phospholipids for building a baby, Nutrifos, and Neurogen is found actually, believe it or not, Neurogen, which is DHA, is actually by law in the baby formulas in Japan, and has been for 20 years. The research is done in Ohio at the university there. And the Japanese realize, very smart Americans, and of course they incorporate it in as a law. You have to have DHA. So if you want to build a baby brain, you want to have DHA in your diet, which is Neurogen, and you want phospholipids to build strong tissues. And of course you have to have the minerals with that, calcium. You want to have zinc and copper and all the other minerals. So you need that. And if you like a smoothie or a drink, I would recommend to take the Life Support. And you might add the Ageless with that, Life Support Ageless combination for a smoothie. But for pregnancy, the following. You want to take Collagen Max and Micelle D3 and Bone Generator. You want to be taking the Vitamin Mineral Max Minerals Plus. You want to take extra folic acid, because folic acid polymorphisms are 1/4 of the population worldwide and up to half of Hispanic populations, depending if they're Native Hispanic. They're much higher risk of up to 50% have a polymorphism, so they can't convert or activate folic acid. And there's a lot of natural antifolates now in the environment that are biotoxins that block folic acid reductase enzymes. So, for example, dioxins and dibenzofuran toxins in the environment, and by the way, the concentration in the world doubled with the burning of the World Trade Center towers. The concentration of the dioxins and the benzofurans, because of the step-down transformers on the entire planet, doubled with just those 2 towers going down. Isn't that crazy? And it's equivalent to going on chemotherapy, to be honest, because a lot of the old-style chemo were antifolate drugs, right? So fluorouracil is one of them, for example. So what do you think of that, Ryan? Is that combination?
Pretty frightening stuff to think about, the toxic burden that we're all exposed to.
Well, I actually think I've got a diagnosis for those people out there. I have what's called the same form of minor Asperger's as Donald Trump and George Washington. Like when you talked about the cherry tree, I cannot tell a lie. I tell the truth even if it hurts. Because you can't move towards solutions, which is probably why Trump is well successful financially, is because he didn't lie to himself about his financial situation when he made a deal. And if you don't face the truth of these toxins and deficiencies, you can't help people get healthier or have normal babies. And so, if you want to have a normal baby that doesn't have, a problem, the same thing as the Zika virus. I tell women, you need to be taking Allicin Med every day. If you take Allicin Med every day, not only do you have thiols in your sweat that will prevent you from being bitten by mosquitoes, but number 2, the Zika virus can't survive to cause UPR, which is unfolding protein activation for your microsomal fraction of your mitochondria in a developing baby brain that will destroy their neurons through apoptosis. So, it's really simple to prevent yourself from getting Zika virus-induced illness. Just take Allicin Med every day. That's how simple it is, isn't it? No bites and no Zika in your body. How simple could it be, right? Well, by the way, we also find the Allicin Med reduces joint inflammation. A lot of people say, well, why is that? I said, because you can actually look at inflammatory cytokine levels in people before and after they take our antipathogenics, and their inflammatory cytokine levels drop and their joint inflammation drops, whether it's tendinitis, bursitis, arthritis, etc. All is dropped because their total, what's called pyrogen load, the load of inflammatory molecules, is significantly less when you take Allicin Med. The inside, outside, whatever, bowel specialist, pediatrician.
I think that, a good category is probably, what do they even call these guys? Who works on the bones, for like osteoporosis and all that? I don't even know. What do they call those guys?
Well, just a general internist or family doctor would work on bones. You might see an orthopedic surgeon if you happen to see one, because, of course, the problem is you're putting all these fancy appliances in their various metal alloys or polycarbonates, and if the bones aren't strong, you're going to shatter them. I had a consult here just a few weeks ago of a lady that was a medical legal catastrophe up in Los Angeles. They did a typical thing like a bone DEXA scan, but they realized she had dense bones on the DEXA scan, but she didn't have strong bones because she had no collagen in them. She had been on bisphosphonates and these injectable things for years. And yes, her bones were dense, but you stick an appliance in there and her bones shattered like a Mexican cracker being put on the top of the stove so you can make up one of those dishes with the crunchy tacos. Well, guess what happened? She was a disaster. She'd get out with her appliance and bam, it broke literally, I think, walking out of the hospital. And of course she's going to sue people because they obviously didn't know what the heck they're doing. And the first thing I tell people with bones is bones are made 42% with dry weight with type 1 collagen that's woven in what's called type 29. And it's where you lay down lamellar bone in these little tunnels. And if you don't know how to lay down bone and your osteoblasts do it, they're like a guy with a trowler on his little knee pads, and he's going down there, the little osteoblasts. They need vitamin D. They need vitamin K2, metaquinone 7. They need type 1 collagen to be present in order to actually do it. And they need to cross-link it as well with proline transhydroxylase enzyme, which are collagen max, which is orthosilicic stabilized silicon to triple the rate of the K-max of the enzyme. And so if you apply all the building blocks, that little osteoblast goes down there and says, I'm going to do this really good job. It's like somebody going and troweling out concrete in your driveway, You got to think of it that way. That's the inside of the bones. So obviously the orthopedic surgeon was just wanted to slap, put in some screws and stick to the appliance. They didn't realize like the material they had to work with was not very good. So she goes out of the hospital doors and shatters her appliance, and now she's a wreck. Now you can't put something back in there unless you rebuild that bone to the point where you have something to attach to. So we talked about this a bit, bone generator, collagen max, etc. But the next area I'm going to switch doctors for you. Let's talk about a bowel doc. How many people, most people are not aware, for example, that some of the artificial sweeteners like Splenda, which is a chlorinated optical isomer of sugar, destroys 80% of the gut bacteria in your gut. So does aspartame. So you want to make a really bad gut dysbiosis, use artificial sweeteners. And most people aren't aware that if you have dysbiosis, it's a major contributor to activating diabetes and heart disease and even cancer. That your gut bacteria generate some of the most powerful anti-cancer molecules in your body are actually generated by your gut bacteria. It's not even your own immune system. They're, in a sense, an accessory to your immune system. So if you see cultures that have, the various strains, I can get into the various fancy long names of them, probiotics, which we have in our Living Probiotic and Living Probiotic Ultra, and also in the Ageless, smoothie drink. But if you don't have these healthy bacteria, and if you don't stimulate healthy growth of these organisms in your gut, you not only don't nourish the bowel wall, you also don't nourish all the tissues of your body to even prevent cancer and heart disease and other problems. So we mentioned this earlier, that the care of your mouth is 80% of the cause of Alzheimer's. The other 20% is your gut. So if your gut's screwed up, and that's why I mentioned about autism, and this is my theory, autism is a gut dysbiosis-induced chromogen dopamine agonist form of schizophrenia. And that big long term, what that basically means, the gut bacteria make these molecules that look like dopamine. They cross your blood-brain barrier and screw you up. It's like your brain, like the old commercial, your brain, this is your brain, like with an egg thrown on the pan on drugs, and it goes and crackles, and then all of a sudden it's cooking. Well, this is your brain on chromogens made by bad gut bacteria because your doctor gave you too many antibiotics before you're 5 years of age, or you got stacked vaccines that fried your immune system, and now you got these dysbiotic bacteria making these nasty molecules that screw up your brain. When I hear people are speculating on that, I said, look, I will dispel your speculations. If you and your doctor thinks they know more than Dr. Dago, I will tell you to contact William Shaw at the Great Plains Laboratory and do an organic acid test. And he can test for the organic metabolites and show you. And then I can do a deep brain study with a positron emission tomography scan and a quantitative electroencephalogram and prove to you with a neuroscientist that the reason why your child's autistic is their brain has an imbalance in neurotransmitters caused by a screwed up gut. Every child has a cholinergic to dopaminergic imbalance. Everyone. That's why when we give things to increase cholinergic pathways like Cognition Plus and Brain Power, ultrathymine B1 is the most important single nutrient. Then when CDB choline or cytidine choline and uridine monophosphate, and then they all have dysmyelination. So if you do a T1 weighted MRI scan, you see just like your bone age, you can do a bone age study. Every single child that has autism or some we call retarding metabolic or genetic disorder has delay in myelination of different nerve pathways, whereas the anterior forebrain bundle, the hippocampus and other areas of the brain, you can actually pick them out in space and actually tell which bundle is not myelinated. It's like going to an electrician and say, these wires don't have coating on them. They're not going to conduct very well. They don't have saltatory nerve conduction. And if you remyelinate them, they start to work. It's amazing. You actually form neural networks and called thought. But most people don't think through that way. They just think, well, anatomically, they have a brain. Well, no, their brain's not connected. Or their neurotransmitters are so screwed up they can't form a neural array. And there's 3 stages to memory. The first stage is what's called virtual, which is a virtual network of activation potentials. The second phase is called facilitated pathways. And the third phase is called microtubules. So if you're out there and you're a neuroscientist, I'm telling you stuff that's tier 1 science that may not be taught at your university, but I know a lot more than that. And I will talk about it a little bit here and there on the show, but I don't want people to use it or DARPA to use it for classified research to modify human consciousness. So The fact is we have things that can enhance your brain function right now or make it return to normal. So 1 in 68 kids has autism. That's my next challenge. Autism, we just talked about it. How many kids do you think are autistic now? And that's why they pulled that movie with Robert De Niro called Vaxxed. They pulled a movie because the big pharma, big vaccine didn't want the truth out, that when you cause BOF or brain on fire, this is one of the consequences. You end up with an autistic child or an adult that gets stacked vaccines, and they get a brain inflammation, and they get premature dementia. And a lot of people don't know they're in trouble until they're down to the last few good neurons that are firing sparks between different parts of their cortex, and they don't remember their grocery list or their name of their grandchild. So what do you think, Ryan?
Well, it's a shame if the truth's being buried, obviously, that, you know, that people are not aware, and then they become, you know, victims.
Well, people naturally are, most people naturally are cowards. They don't want to say the truth, except in reverse speech. In fact, this week we're going to have on the program on Thirst Hour David John Oates, and I'm going to talk about the scientific basis and the biblical and spiritual basis for reverse speech. Your subconscious and your soul can't tell a lie, even if you're evil. Which is why when Obama has a speech, you can hear the reverse speech in it. Well, the same thing, if you tap into the superconscious and you want to fix the brain, you have to fix it on multiple levels. Just like you want to heal somebody, you got to heal them on a social level, a biochemical and genetic level, a toxicological level, and a spiritual level. You don't just heal somebody on one level and say, take these pills and see you later. That's why we call it a ministry, because it is a ministry. You don't just, if somebody's chronically emotionally stressed, just giving a supplement won't fix it all. Like depression, we tell people take BioLVR. We have a thing called Mood Elevator, which is our Positol, Mood Elevator. And we have things like Semethyl that will work very fast. Usually this protocol of BioLVR, Semethyl, and Positol will pull you out of depression. And I use also Minerals Plus, because the minerals in there are necessary for bioconversion through the tryptase and pyrrolase enzymes to convert amino acids in your brain to neurotransmitters and make your depression go away. And if you're hypoactive and you're dragging your butt, Cognition Plus and Brain Power, maybe the little brother called Synaptin, but Neurival, which is acetyltyrosine, will boop it up. And if you want to increase your levels of tetrahydrobiopterin rather than taking the BH4, which we had before, but we may get it back. It's real difficult to get it made, by the way. We have protocols that will pull you out of depression. You do not need to be PTSD, post-military. You don't need to be depressed. Don't need to be in a state of a fugue or schizophrenic. We can fix every one of them and prove to you with functional medicine tests that we've corrected your problem without drugs. It may be shocking, but it's true. Thank you, Ryan. We'll be back in a few minutes over the top of the hour. And coming up in hour number 3, Mike Velarde, and our IRS expert. He's got an amazing book coming out in June. He'll announce when he comes on.